In our ongoing commitment to give you the best breast health information, we are back again today at Roswell Park Comprehensive Cancer Center with Dr. Helen Cappuccino, a surgical oncologist. She's been here for a long time. A lot of people, we'll see nobody else but Dr. C. Today we're going to address breast cancer during pregnancy. So good morning, it's nice to have you here.
Hi, how are you?
Good, that's scary. Do you detect a lot of breast cancers when someone is routinely being checked for pregnancy or is pregnant?
Fortunately, not too many cases, but it certainly happens from time to time. So I guess really the most important take-home message for women is just because you're pregnant doesn't mean you're protected from getting breast cancer.
Yeah, so true. I would imagine that would be such a scary thing for a woman to be told you have breast cancer while pregnant. What do you do about that?
Yeah, you're absolutely right. It is very scary. And for these women that are pregnant, you have to remember they're already in this hormonal upheaval.
Right.
They've got the joy of the pregnancy, and then to be diagnosed with breast cancer on top of it is, it's really scary. And it does, depending on the where they are in their pregnancy, it will impact on what diagnostic tests and what treatments we can offer to them.
We're always trying to get the message home to please have your annual mammogram here at Roswell because you have so many specialists. And if something like this were to crop up, again, your specialists are right here that will work with you from the moment you find out till post-pregnancy.
That's absolutely right. Yeah, absolutely. If you have any lumps that are found during pregnancy, obviously there are going to be changes in the breast tissue during pregnancy, but something that's persistent, even beyond a few weeks, you should certainly bring it to the attention of your gynecologist, OB/GYN, or your family practice doctor. And if you have lingering doubts or concerns, please come and see us here at Roswell. We can work it up and make sure everything's okay.
You know, we might have a lot of people who might think, gee, I never thought of getting my annual mammogram while pregnant. Can you get one?
Yes, we wouldn't do a routine mammogram, although the dose of radiation from mammography is fairly low. We don't want to take any chances, and we can certainly shield the baby. We have special gowns that shield the baby, but we wouldn't routinely do that. So for instance, if a woman were having a child during the period of time during which she might normally get a mammogram, we'd probably wait and do it after the pregnancy, or if she were thinking about getting pregnant and due for a mammogram, we'd want to get it done right beforehand.
If a woman is diagnosed with breast cancer, does it depend on what stage she might be in to how you might be treating her?
Absolutely. One other point I just wanted to make about a lump during pregnancy is there are other diagnostic modalities that we can use, specifically ultrasound, that can give us a lot of information as well. But yes, during pregnancy, that we would modify a little bit what we would normally do during pregnancy. To treat breast cancer, there are basically 4 different interventions. There's surgery, there's chemotherapy, there's radiation therapy, and anti-hormonal therapy. And we use various combinations depending on the stage of disease. But when a woman is pregnant, we need to avoid chemotherapy during certain points of the pregnancy. Believe it or not, you can give chemo safely during certain portions of the pregnancy. And radiation we avoid pretty much at all costs because there is some potential jeopardy to the fetus.
Well, you know what? I find that very comforting because a lot of people will think immediately, I cannot possibly be treated because I am pregnant. That's just absolutely not true. And that's why you want to come to Roswell and talk with people like Dr. Helen Cappuccino. It's fascinating information. Again, we're here at Roswell Park Comprehensive Cancer Center. And remember, you can have your annual mammogram here, even if you've never been a patient of Roswell. They do a wonderful job. They welcome you. And if there were a problem, you've got all the experts standing by, like Dr. Cappuccino. Thank you so much.
My pleasure, Linda.
All right, everybody. Remember, log on or call today.